Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. In this occasion, I'm going to present our paper entitled The Predictors of Overweight and Obesity Among Children and Adolescents in Developing Countries, a literature review. Let me begin this presentation with a short introduction and short hello from us. My name is Anindya Maratusolika, and I'm junior lecturer in Faculty of Sport Science, Universitas Negeri Surabaya. And this paper also co-authored by Nick Ani Afikah binti Haji Muhammad Tua, or usually called Dr. Nick. She is an associate professor in Institute of Health Sciences, University Brunei Darussalam, and she was my supervisor back then during my study in UBD. Okay, let me start the presentation with the problem statement regarding the severity of overweight and obesity in the world. Overweight and obesity has become a serious health problem that affects a lot of people in all ages, of all races, ethnicities, and income levels. And the number is rapidly increasing, especially in child and young population in developing countries. Obesity has been labeled a childhood epidemic, as we are now seeing more children and adolescents getting obese. As you can see in the World Atlas here, that show the prevalence of obesity in child and adolescents. And what about in our country? In Indonesia, obesity and overweight affect 1 in 5 primary school age children and 1 in 7 adolescents, according to the 2018 National Basic Health Research Survey, or ISSSES. And of course, we are not happy with the numbers, as most of us are already aware that obesity could lead to serious health problems as well as economic burden. As we know that obese children and adolescents are more likely to suffer from non-communicable diseases such as diabetes and cardiovascular diseases, as well as depression due to stigmatization they received. And in terms of economic burden, the estimated medical expenditure caused by obesity was around 116 million USD, with the total indirect cost due to the loss of productivity or daily loss was around 28.3 billion dollars USD, or approximately almost 400 trillion in Indonesia rupiahs. If we calculate all the costs, the proportion of total macroeconomic and loss due to overweight and obesity in 2016 was approximately reaching 3.04% of our total annual GDP. And tracking two risk factors of overweight and obesity in children and adolescents will help us to develop a policy regarding the obesity prevention. Thus, we conduct this literature review to identify the factors associated with overweight and obesity in developing countries to find the similarities and pattern. Thus, we can reduce the number of obesity together toward the achievement of SDGs. Okay, now we move forward to the method that we use to conduct this systematic review. We did a comprehensive search of literatures published no later than 10 years prior to 2017 using two search engines that most of us already know, which were Google Scholar and PubMed. The electronic search used medical subject headings or mesh with certain keywords such as children, obesity, predictor, developing country, and all of its synonyms. And here we also provide you with the flowchart or flow diagram showing the process of literature searching that we conduct. In the first step, we successfully gather around 9,000 documents from two databases using the keyword. After that, we did several exclusions to remove the documents that did not meet the inclusion criteria, such as experimental studies or other studies using non-cohort or non-cross-sectional designs, or studies conducted in developed or high-income country, and etc. And from the selection process, we had 32 eligible documents to be critically appraised using a modified quality assessment tool. And after the careful analysis, we had the remaining 9 studies to be included in this systematic review. And for the results, we have tables that summarize all of the studies that we have critically appraised. I have highlighted that all of the studies have similarities regarding the risk factors of obesity and overweight in children and adolescents. Most of studies that we have compiled show us that the prevalence of overweight or obesity was higher among boys than girls. It might be related to cultural issues, as some families, especially in Asian countries, in South Asian countries, still favor boys over girls. That made the boys had more access to food. And overweight or obesity in children were also related to parental obesity, where mothers or fathers' high BMI will increase the risk for their children to have high BMI too. And other factors that is related to childhood obesity is social economic status. We found strong correlation between parents' education and family income with obesity. Uh, Family with higher socioeconomic status tend to shift their lifestyle toward sedentarism, and also they were more able to afford different kind of food, including calorie dense one, making their child more prone to get excess fat. And besides food intake, overweight and obesity in children and adolescents were also correlated with dietary habits such as fast eating or eating a large amount of food in just one sitting. And the last but not least, we found that physical inactivity was a key factor related to obesity among children. From 9 studies that we have reviewed, 7 of them agreed that children who spend more times in sedentary activity, like watching television or playing handphone, were more at risk to be overweight or obese, as it would decrease the amount of time spent on playing outdoor games or doing physical activity or exercises, which this might resulted in weight gain. And from this discussion, we have concluded that the cause of obesity is multifactorial, ranging from the most basic one as genetic and biological factors to socioeconomic factors. And the findings from this review have important implications for actors such as government, policymakers, planners, or other stakeholders in all levels to develop policies to combat obesity, especially during childhood. And also intervention at household levels and beyond is also important and needed to lower the prevalence of obesity in children and adolescents. Okay, I think that's all from our presentation. Now we are welcoming your question. Thank you.